poop ninjas on land or by sea. That is the role of your team. Hello to all of you beautiful birthing people. Welcome back to my channel. My name is Elizabeth, also known as Nurse Sabe, here on YouTube and Instagram. I am a labor and delivery nurse, postpartum nurse, certified childbirth educator, and mom to 3. And today I wanted to answer some of y'all's most taboo and embarrassing questions related to labor and postpartum, because let's be real, when we're talking about giving birth, there are a lot of things that we feel like we can't talk about. And when we don't talk about things, we don't get the education that we need to tackle these issues. And so my goal with this video is to answer those questions for you guys so that you have a better and comprehensive understanding of the labor and postpartum process. So all of these questions were asked over on my Instagram. Definitely head on over there. Give me a follow if you want more education. Without further ado, let's go ahead and jump into it, and make sure that you like, comment, and subscribe on this video if you find this information interesting. So one of the first questions that I got was, can I cover the clock in the room? And to this, I say yes, 100%. So when you are laboring and coping through labor, you are using the neocortex of your brain. This is like the mammalian part of your brain, the part that is really similar to any other mammal giving birth, not using your frontal cortex or that higher level thinking. And when we're thinking about time passage, when we're thinking about how long this is taking, that takes you out of that neocortex and into that frontal lobe. So you'll notice that in most labor units, the clock is actually situated back behind the bed. But more than likely, and hopefully, if you're laboring unmedicated, you're not in the bed, so you're moving up and around the room. It is totally fine and actually a great idea to ask to tape like a piece of paper or something over the clock so that you are not aware of what time it is. Now, there might be times when we need the clocks, particularly when we're in that delivery process, to know timing of everything, but this is a great option so that you aren't focused on the time. Another great option so that you're not focused on the time, and one of my favorite things to do, if you followed me here for a while, you'll know this, is laboring in the bathroom. And a lot of our questions today have to do with bathroom type situations because, let's be frank, pooping on the table is one of our biggest worries. So I have a whole bunch of questions about pooping with delivery. I'm gonna summarize them all for you here now, and then we'll jump into the answers. So one question here is, how do you know if you've pooped on the table? Another one is, when I gave birth to my second, I pooped and it smelled so bad. Is that common? How often do women poop while pushing? So here are the answers to all these questions. And I think the biggest and overarching answer that I want to give you is that your nurse does not care. Your care team does not care if you poop while you're pushing. Hands down, bar none, do not care. Because it's quite common. I am not sure of the exact statistics. I feel like for me, I see it maybe in about 50 to 75% of births. A small amount of stool is passed during the pushing process. And typically, it's not like you're pooping an entire normal sized poop in the toilet type poop. It's just like a little nugget or something, just a little nugget poop. And so I consider myself a poop ninja. My nurses, when I had my babies, were poop ninjas. We wipe it away, we throw it away. We're not gonna highlight or tell you unless you're super curious. If you ask me if you're pooping, I'm gonna say you're doing great and you're pushing in the right spot, because here's the thing. You're gonna feel like you're pooping no matter what. No matter what. Because of where that baby's head is situated, and the nerves that that baby's head is pressing on are connected to your colon where the poop comes out, to your rectum. It all feels like you're pooping. If you poop, it feels like you're pooping. If you don't poop, it feels like you're pooping. So if you shy away from that feeling, because it is a weird and vulnerable feeling to feel when you have maybe people that you don't know that well, or strangers, right? You've never met your nurse before, they're in the process, then the process is going to take longer and it's going to be more painful and more uncomfortable too. So just get in your head, hey, I'm probably going to poop when I'm pushing, and that's okay. The other question of like, it smelled worse than normal. Because of COVID, most hospitals are still having all of the staff wear masks, so I can't really smell what's going on. I don't necessarily know that your poop smelled worse than normal, but what we do know about labor is that we have really heightened senses. Our sense of smell is particularly heightened during labor, and this is actually a protective mechanism that our body has, because we need to be like making sure that there are no scary bears coming to attack us to enact our fight or flight. So this is one reason too why I recommend not diffusing essential oils, but using them in a more contained way so that you can take away the smell if it becomes overwhelming to you because your sense of smell is so strong. Another question about poop, because let's face it, a lot of us are worried and concerned about poop, and this one is in regards to water births. When you have a water birth, doesn't the water end up being full of poop? When you're having a water birth, whether it's in a freestanding birth center, in the hospital, or at home, so your midwife, OB, or nurse will have one of those mesh nets that you would use like in a fish tank to take the fish out so that you could clean the fish tank, and we just take the poop out and get rid of it. Poop ninjas on land or by sea. That is the role of your team. And yeah, you know what? There is a reason why babies come out of that area. Their gut, everything is sterile, and they're getting naturally populated with a whole bunch of good bacteria. So in my brain, would it have made sense for our butt and our vagina to be maybe just a smidge further apart? Yeah, but in the grand scheme of things, it is that way for a reason. Okay, moving away from poop. Let's talk about gas. Everyone talks about pooping while delivering, but one thing I was not expecting was the inability to control anything, i.e. gas, after my epidural, and I was mortified. Is this common or just me? Totally common. Totally common. So we naturally can control gas by holding our sphincters closed, our anal sphincters, and we do have 2 of them. But when you have an epidural, it helps relax your pelvic floor, it helps relax those anal sphincters, and that's when one way that the epidural can actually help our labor to progress is it releases some tension in that pelvic floor. But unfortunately, with that release of tension in your baby's head moving down, your baby can actually push out poop or push out gas, and since you can't tighten up those anal sphincters, you're not feeling what's happening, it can just pass. So don't be embarrassed if when your nurse is assisting you in changing positions, or as you get closer to fully dilated, you pass some gas. And really, at the end of the day, it's just a part of having a baby, and better out than in is what I always say. Okay, here is another question that I got quite a lot, some variation of this question. Can nurses stop you from eating? I was only allowed Sprite for 28 hours considering baby number 2. How do you feel about patients sneaking food? Are you allowed to eat in labor? How to know when it's actually important not to eat and when it's just a dumb rule. So the thought process of, hey, we shouldn't be eating in labor, or you shouldn't eat after you have an epidural, comes from the thought that if we needed to do an emergency C-section and we needed to intubate you, would there be an increased risk for aspiration, aka you throw up and then breathe in the throw up into your lungs that could cause a lung infection and potentially death. That's why we worry about it. This is actually really old advice, but it takes a long time for evidence-based research to trickle down into the hospitals into evidence-based practice. And the one thing that I want to say that is really important that I want to highlight, I can say, hey, the order is for you to not eat anything except for liquids, but then you can do whatever you want. I have to educate you, and then you get to make the decision. Now, it might feel like that's not possible, and I totally understand where you're coming from, where you're like, the nurses won't let me have anything, but at the end of the day, you're not really sneaking food. I'm providing education on what's ordered, and then you're making the decision because you have medical autonomy over your own decisions. The uterus is a muscle, and it needs food, and it needs water to work. It needs energy. I think especially in early labor, it's good to be snacking and eating and what sounds good to you. And then as we move on, even if you do get an epidural and your anesthesiologist is recommending clear liquids, and that's what you are thinking sounds good to you, because as we get further on into labor too, you don't want to eat. Like, it just doesn't sound good. We have less blood flow to our gut, and so we're not really feeling like we're super hungry. We can eat and drink things that still give us some energy and some sugar. So we can have a juice, we can have a soda, we can have a popsicle, we can have chicken broth. But our doctors do a really good job of actually encouraging, especially with inductions, because inductions can take days, encouraging patients to eat up until active labor, and then maybe limiting or eating a little bit less or focusing more on liquids after active labor begins. But at the end of the day, it is your decision. Now, if we are truly concerned, if there's something going on, if we're having changes in fetal heart rate, something like that, then I think really sitting down with your provider and having that conversation of like, this is why I'm concerned and this is what I'm recommending. I think having that open and honest communication with your provider is great, and a great question to ask before you even go into labor, what they recommend you do. And then if it's, hey, nothing but ice chips, hey, can you tell me why? Because here's the evidence, and I will link below evidence-based births resource on eating in labor because it can be a really great way to bring that evidence up with your provider. Now, if you are coming in for a scheduled cesarean birth and there's nothing emergent going on, they will give you a time when you should stop eating by. And yes, that's when you need to stop eating by, because if you come in and you've been eating all morning, then they will go ahead and they will wait on the cesarean until they have that amount of time, because it is not an emergent case, or it's not a case that needs to happen very quickly. It is scheduled. So here's another labor question. Is it okay if I make noises the whole time? I can't deliver quietly no matter how hard I try. Of course. Of course you can make noises, and it's normal to make noises. Ideally, we want to focus on those noises being low and open, keeping our vocal cords nice and relaxed, because that is connected to our pelvic floor. But literally, my mantra with my last birth was the F word. Over and over and over and over again. And that's okay. It's also okay if you're very silent. I have people who give birth and literally, I'm gonna do a reenactment. She was like, okay, it's time to push now. Ugh. Baby up on her chest. I'm so sorry I was so loud. I was like, I'm louder having a poop, and that's okay. Do what works for you. Don't let anybody tell you to be quiet in labor. Now, sometimes your nurse might try and help if you are screaming and in that higher register and really tensing and having a hard time coping. They might try to help ground you and bring you down from that, but they shouldn't shush you. They should show you how to breathe. They should show you, let's do some low noises. Let's do some horse lips, okay? But nobody should be shushing you in labor. And if they do, I'm gonna shush them, because it ain't right. You do you, and you have a baby. And it freaking hurts sometimes, and it feels really weird. So make the noises that you need to make and get channeled into that mammalian part of your brain. Here's a question that I got quite a few times, and this is really important information that I wanna make sure that you guys get. What if you're not vibing with your nurse, had a pushy one who doesn't listen, and after her shift, we asked for a different nurse for the next night? Is that rude? No. No, it is not rude. It's also not rude to go out to the nurse's station and ask for a different nurse to be assigned to you from the charge nurse. Not everybody's gonna vibe. I don't vibe with everybody. Everybody doesn't vibe with me. We all have different philosophies, and we all need different kinds of support. And it's hard when you're going to the hospital and you're meeting a nurse for the first time who's supposed to offer you some really, really great support, and most of them do. But maybe this nurse and you just don't have meshing personalities. It is okay to ask for a different nurse. Your birth is important and your birth matters, and having the support there to help you meet your birth goals is so, so important. It is totally fine to request a different nurse. If they're being straight up rude or hateful, you can request it to their face, but I'm, a millennial people pleaser, so what I would do is send my husband or my partner out to the nurse's station to speak to the charge nurse to ask and request for another nurse. But that's just me. You do you, and it's okay too if you are like totally just like, get me a new nurse, because it can be difficult when you and your nurse aren't vibing and they're not making you feel comfortable, safe, and secure. We need those feelings in order to have our best births possible. I don't want to play the blame game with anyone, but someone woke up a little early from her nap. So we are going to try and get through. Was it you? Was it you? Yeah, we're gonna try and get through a few more of these taboo or embarrassing questions, and definitely if you like this video, let me know. I can do a part 2 because you guys had so many good questions. Rosie, would you like to do the honors? Just kidding, you can't read. Now, one thing I did get a lot of questions about is being intimate in labor and delivery. So having sex in the labor and delivery room, no reason why that can't happen. Can clitoral stimulation help ease pain in labor for some women? Would nipple stimulation trying to achieve orgasm before water breaks to progress to labor be a no-no in the hospital? So, I want to answer all of these. First of all, I would not recommend having sex in the hospital, because when we're having sex to stimulate labor, what we're trying to do, right, is get oxytocin flowing. We're trying to get the prostaglandins from the semen, if we're having heterosexual intercourse, to do its thing. But also, like, the hospital might not be the best place for that to happen. Now, if you are in early labor and you want to have sex at home, I think that that is fabulous if your water's not broken. Once your water's broken, we really want to limit what things are going inside the vagina, because that can increase our risk of infection to your little bub. Now, nipple stimulation is definitely something that I encourage my patients to do in the hospital setting if we have a stall or a slowing in labor, as a way to pick things up if they are not wanting synthetic medication to help with that. And so typically what I do is I explain how to do nipple stimulation, I talk about what it is, and then I say, I'm gonna be gone for 30 minutes. I'm gonna put up a note on your door that says not to disturb you. And then when I come back to listen to baby in 30 minutes, I will be back in 30 minutes. So do with that what you will. I never am like, did you do nipple stimulation or what did you do? Because the whole point of it is that you need to be relaxed for it to really do its best work. Now, as far as clitoral stimulation or external stimulation, there are definitely people who find that to provide some relief during labor and the laboring process and the pushing process. And if that is you, I say do your thing. I'm not going to say anything about it. I'm just going to be there making sure that you feel safe, secure, and comfortable. So you do your thing. If your water's broken, that can be a great way to kind of get that oxytocin release from sexual pleasure without actually putting anything inside of your vagina, because we want to limit that. The next question that I had a lot was asking, should I really wait 6 weeks after I've had a baby? Having sex after delivery, waited 8 days, couldn't wait any longer. Urge was so strong, C-section mom. Is it normal to want to have sex within days of a C-section? Is it hormones? So I think that after you've had a baby, and you experience this like brand new closeness with your partner, I felt this especially after our first, you want to feel close with them. And so sex is one way that a lot of partners and couples feel really close to each other. But I also want to caution you that you have just had a baby that has either come out of your vagina or it has come through your abdomen through a major abdominal surgery. And I really, really, really encourage you to wait that 4 to 6 weeks, whatever your doctor is recommending, to give yourself time to heal. Your cervix is still open. We can introduce infection up into the uterus. So you really want to try and find ways to be intimate with your partner that don't involve penetration of the vagina. This might be some external stimulation. This could potentially just be lying together and snuggling and basking in that glow of your brand new baby. Because I totally understand hormonally. I feel like we hear over and over again, oh my God, he's never touching me again. He's never touching me again. But what if you feel the other end of that spectrum? I want you to know that that's normal, but I would encourage you to wait to give yourself a chance to heal. Even if you've had a cesarean birth or you have an intact perineum, there's just a lot going on. And your body is still bleeding and working hard to get your uterus back down to its normal size. It's working hard to heal an incision or a tear. I would wait for 6 weeks. I have a whole video on postpartum sex with Dr. Little, an amazing pelvic floor PT. So definitely go check that out. I'll leave it linked. I also have a video where I went and saw the pelvic floor PT, and I have a few more taboo questions that I just want to touch on very quickly about postpartum and what is normal versus what is common postpartum. And a lot of you guys gave me questions that I'm like, hey now. So that might be a symptom of prolapse that you aren't even aware of. So check out that video where I go see a pelvic floor PT, and honestly, Dr. Little and I are hoping to get a video up for you guys on prolapse because you guys have a lot of questions. Is passing gas excessively a thing in the months postpartum? I think that there are a lot of changes that we experience, but if you're passing gas, particularly if you're unable to not pass gas, like you can't hold it in, it comes out when you're trying to hold it in, that can be a sign that there might be a prolapse or something that you want to explore with a pelvic floor PT. Ever since I had my daughter 2.5 years ago, I can't get 100% clean down there after I poo. Why? That is also another really common symptom of a rectocele or a rectal prolapse. And I just want to be completely honest with you guys. I have both a cystocele, a grade 1 cystocele, which is a bladder prolapse, which honestly a grade 1 is pretty common after you've had a couple of babies. That's the lightest one. And then I also have a grade 2 rectocele. So I totally feel you with that. Sometimes it can be really hard. Bidets can help and warm wipes can help, and just taking plenty of time to wipe, but definitely seeking out a pelvic floor PT, because while it might be common, it is not normal to have that be an issue for you, and it's embarrassing and not something that you should have to deal with. Okay, so I think those are all the questions that I have time to answer now. I have so many more questions. I would love to do a part 2 of this video, hopefully when nap time does not interrupt us, Missy. Definitely, if you have any other questions, you can go ask me over on Instagram if you want to be anonymous. Leave them in the comments. Leave your advice and your experience too if you're comfortable with sharing, so that other people know that they are not alone in these really common things that happen during and after you have a baby. Because it's kind of a crazy situation and we just should talk more about it. Until next time, bye guys!